shock a lot. Okay, next we go to abuse, okay, and neglect, okay. Okay, they're abuse, Chinese, okay. When you say neglect, okay, you don't take care of them, you just leave them alone, okay, they're neglect, okay. So abuse and neglect can be both found in children and the elderly, okay, your grandparents, okay, not only the child, but also the elderly. So you have child abuse, child neglect, elderly abuse, elderly neglect, okay. That's why in the picture you can see not just the child there, okay, but also the elderly, okay. Let's go first to child abuse, okay. So what do we mean by child abuse? So this includes physical abuse, so you hurt your child. Emotional abuse, you shout at your child, okay? Right? Emotions, okay? Neglect, okay? So intention means intentional omission of basic needs, okay? So if you don't give the basic needs of the child, that is neglect. What are the basic needs of the child? The child have the right what? To eat, right? The child have the right to play. The child have the right to sleep. The child have right to go to school, to study. Eh? If you don't give them, that is neglect. Okay. What else? This also includes sexual molestation or exploitation, so sexual abuse in the child. Okay. So if they ask you in the exam, who among these patients are the high risk to develop child abuse? So keep this in mind. So they say prematurely born children, those who have LBW, low birth weight, and less than 3 years of age. So infants, right? Less than 3, okay? With physical and or mental disabilities, okay? What is a good example? So children with autism, cerebral palsy, ACP, okay? Cerebral palsy, okay? Down syndrome, okay? There, okay? Physical or mental disorders. Okay, so how will you suspect that the child is abused? Okay, how will the nurse know? Okay, so here, number one, there's inconsistency of the injury with the history of the incident. So for example, you ask the mommy, what happened to the child? The mommy will say, oh, the child is playing and then he accidentally started the fire, that's why he burned. So the story does not match the injury of the child, okay? Assessment, so you look at the child, so what will you see? Unexplained bruises, okay? Bruises in the body, okay? Burns, especially at the back, okay? Fractures, okay? Chip and spiral type of fractures in the bone, okay? What else? Severe CNS and abdominal injuries, okay? So here, okay? Bald spots on the scalp, why? Due to hair pulling, okay? The parents will pull the hair of the child, okay? So you will see bald spots on the scalp, okay? Hair pulling, okay? Or trauma, okay? When the mother pulls the child like that, okay? Hair pulling, okay? What else? When you put the child in front of the parents, they fear the parents, okay? They don't want to get close to that parent, okay? And then you will see inadequate weight gain, poor hygiene in the child, okay? Poor school attendance, so the child always absent in school, okay? Failure to thrive and learning problems, okay? And in women, in the girl, you will see genital lacerations or even sexually transmitted disease if the child is sexually abused by the father, okay? And difficulty walking. You will see the child walking awkward and cannot sit, okay? And sleep disturbances, okay? They usually shout at night, they have a bad dream, okay? What else? Some children don't cry when you put them in front of a stranger, okay? They don't cry. What else? They also have habit disorders. You can also add there, okay? Disorders, okay? Habit. Example, nail biting. You will see the child biting the nails like that. Okay, habit. Nail biting, okay? What else? Sucking. Okay, sucking the thumb. Like that, okay? And rocking. Rocking means like that. The child is sitting down but is moving like that, rocking by himself, okay? So these are the signs and symptoms you should look for a child if you're thinking of a sexual child abuse, okay? So if they ask you in the exam, what is your priority for a child abuse? So number one, physiological need first, okay? If the child is hungry, give him food first before you ask questions, okay? So physical needs first. If the child feels cold, give a blanket, okay? Remember that, okay? So mandatory reporting, okay, meaning you are required to report it, okay, to identify suspected cases to appropriate agencies, okay. Non-judgmental treatment of parents. Do not blame the parents, even if they are the one causing it to the child, okay. Assess the injuries, communicate at child's eye level. That's why when you have a child abuse victim, what do? You sit down. You talk to the child eye to eye, okay? Or you put the child on the table so that eye to eye level, okay? Reassure the child that he is not a bad person. You tell them, you are not bad, okay? It's not your fault, okay? It's your parents' fault. No, kidding. Nurses should be non-judgmental. I told you, you should be in the middle, okay? Neutral. Document the case objectively. So what you write down, you just say, I find burn, like that, and bruises on the child. Do not put your opinion. You don't put there, I think the mother did this to the child. No, okay? Should be objectively, okay? Provide emotional support. So what therapy do we give? Again, play therapy, okay? Provide parental education and refer to crisis hotlines. Next will be elder abuse, okay? So the grandparents, okay? So this also involves physical abuse, so you hurt your grandparents, sexual abuse, psychological, financial abuses. What do you mean by financial abuse? You don't give them money, okay? Neglect, so you leave them alone, okay? And abandonment, okay? Abusers may be the caregivers themselves, usually, okay? Usually the abusers are the family members also, okay? Victims are usually isolated or they live alone, okay? High-risk groups, so elderly with chronic illnesses and elderly dependent on their children and grandchildren for financial support, okay? So again, what will you assess? How do you assess the elderly for abuse? So you look for signs of fracture, okay? Bruises, laceration, and burns in the body, and physical evidences of sexual abuse, okay, especially if it's a female. What else? Elderly who are over or under medicated. They don't have medicines, okay, or they are given too much medicine so that they will not wake up anymore. Okay, okay, what else? No dentures, if they don't have reading glasses, they have poor nutritional status, dehydrated, confused, fearful, agitated, and poor grooming, okay? They don't buy them clothes, okay? Okay, so what should nurses do? Provide, again, their priorities what? Physiological needs, so physical needs and safety first. Okay, so if the elderly is living with the abuser, so what should you do? You remove the elderly from the house, right? You put her in somewhere safe. Remember, safety first, okay? Physiological first and then safety, okay? Report to appropriate agencies, so state laws may vary or change, okay? Assess for physical injuries and treat them. Explore alternative living arrangements, okay? Refer to protective services, okay, for adults, and arrange counseling and treatment also for the abuser, okay? So here you can see sexual abuse in a child on the left and sexually abused adult on the right, okay? So what are the signs and symptoms? For the child, so poor growth and development, sleep and eating disturbances, self-destructiveness. What do you mean by self-destructiveness? So the child always hurt himself, okay? Difficulty walking, sitting, itchy, painful, swollen genitalia, or friends in the school, okay, there. For the adults, how will you suspect that adult will have to be sexually abused? So they have many body complaints, say somatic complaints. Something's wrong. Okay? Phobia, panic attacks, suicides there, okay? Ideations, suicide ideas, okay? Self-mutilation, so they also like to hurt themselves, okay? Fear of intimacy and abandonment, relationship issues, and they also have flashbacks and nightmares. Like your PTSD, post-traumatic stress disorder, okay? So nursing considerations, in any victim of sexual abuse, what should you do? What's your priority? Trust, okay? Because the victim doesn't trust anybody, because the abuser is their family member, right? So your priorities is to establish a trusting relationship first. Use empathy, active support, compassion, and warmth, okay? Be non-judgmental, okay? So put the patient in group, meaning group therapy, or individual, your psychotherapy, okay? And give your medications as needed. We usually give anti-anxiety medications for sexually abused victims, okay? Okay, next will be your psychosexual alterations, okay? There, psychosexual, okay? Psycho means mind, okay? Sexual, okay? You know this woman? The naked woman riding on the horse? She's famous. Who is she? Do you know this girl? You know her? No? She, you know the very famous chocolate, right? Very expensive. They named the chocolate after her, right? Godiva. Okay, you know the story of this? No. She's there, okay? She's a noble woman. Yeah? Here, noble woman, ordinary person. Okay? Okay? Because her husband is very bad, okay? The husband gives some very high tax on the people, okay? So her husband doesn't want to listen to her to lower down the tax. Okay, so what she did, she removed her clothes, ride on the horse, and okay, there, okay, walk around, ride around the town, okay. Okay, so these are some sexual expressions, okay, so these are some medical terms that you should know, okay, so when you say asexuality, okay, A in front of a medical word means what? None. Okay. People who do not exhibit sexual attraction or who otherwise find sexual behavior unappealing, okay, asexuality, okay. Auto means what? Self. Okay, so sexual desire towards one's own body. You love yourself. Hetero, remember this is the normal male-female sexual relationship. So we call it heterosexual, okay? Homosexual means same sex there. Homo means same, okay? So same sex. Bisexual means both sexes, male and female, okay? Transvestism, okay? Transvestite, meaning obsession with wearing the clothing of the opposite sex. So girl wear the male's clothes and the guys wear the female's clothes, okay? Pansexuality or omnisexuality, okay? Pan means what? All. Okay? So all. The desire for people regardless of their gender, identity, or biological sex. Okay? They don't care if you're Asian or white or black. Okay? Okay? So we have this medical term. We called it paraphilias. Okay? Here, now. Paraphilia. That's the general term. Okay? Abnormal, okay? Sexual attraction, okay? Okay, so what are paraphilias? Okay, so it's a term describes a family of persistent intense fantasies, aberrant urges, or behaviors involving sexual arousal to non-human objects, pain or humiliation experienced by oneself or one's partner, children or non-consenting individuals, or unsuitable partners. So it's a general term, okay? It may interfere with the capacity for reciprocal affectionate sexual activity. It is also used to imply non-mainstream. When you say non-mainstream, not normal, okay? Sexual practices without necessarily implying dysfunction or deviance. Also, it may describe sexual feelings towards otherwise non-sexual objects, okay? So these are the examples of your paraphilias. So number one, okay, transsexualism. Okay, here. Transsexual means you want to change your sex, male, female, female to male. Okay? Feeling that one sex is inappropriate, okay, and desiring to acquire sexual characteristics of the opposite sex, okay? There. Next, okay, exhibitionism, okay? Sexual urges and fantasies and exposing the genitals to the public. So sometimes you will see a person, okay, open that in front of you, okay, he's fully naked, like that, okay? That is exhibitionism, okay? Okay, the exposing the genitals to strangers, okay? Frotteurism, okay? Intense sexual arousal or desire when rubbing, okay, against a non-consenting person, okay? What is frotteurism? Sometimes you experience this in the MRT, right? When it's too crowded and somebody is touching you, okay, from the back. That is frotteurism, okay? The rubbing against a not consenting person, okay? Next, Michael Jackson, you know, okay? Pedophilia, okay? Desiring sexual activity with a child under 13. Pedia, child, okay? Philia, like or love, okay? Next, voyeurism, okay? Voyeur means what? You want to look there. They just want to look at naked people there. Voyeurism, okay? Okay? Sexual gratification through observing others disrobing, okay? Disrobing means removing the clothes, okay? Or engaging in sexual activity. Okay, next, okay? Here, sexual masochism, receiving pain. So like that, Okay, you hurt the person. Eh? The person likes to be hurt. Okay? So, hit me, hit me. That is masochist. Okay, sadism is the opposite. So this is the one that involves giving the pain. Okay? Here, receiving the pain. Here, giving the pain. Okay, sadist, masochist. Okay, fetishism. Okay, what is fetishism? Non-living objects. Okay, fetishism. Okay, non-living objects. Okay, like the sex doll. You know the sex doll balloon. Okay, like that. Okay, and then you have your transvestic fetishism. This is what we call your cross-dressing. Okay, here, cross-dressing. Transvestic fetishism. Okay. Okay. And lastly, zoo. Zoo means what? Animal. Okay. Zoophilia means their sexual attraction for your pet dog, pet cat. Okay. Okay. Telephones, catalogia. Okay, so there. Okay. By obscene telephone calls. Okay, so phone sex. Okay. Vincilagnia, so by bondage. Bondage means being tied up. Okay. Vincilagnia. Okay. Necrophilia, the dead. Okay. These are the people who sex with dead people. Okay. Copro, feces. Uro, urine. Emeto, vomiting. Remember, vomiting emesis, right? So emeto. Okay. And klisma, sexual pleasure from enemas. Okay, klismaphilia. Okay, so what should you do if you have patients like this? Okay, so assessment of sexual history and precipitating event for the sexual disorder. Encourage the client to explore personal beliefs. Non-judgmental attitude again there. Okay, supportive psychotherapy and initiate psychoanalysis as prescribed by the doctor. Okay, next we go to crisis, okay, intervention, okay, here, crisis intervention.